I thank the House for the opportunity to address the issue of reopening in-school teaching and learning for students with special educational needs, and indeed to update the House on the efforts that have been made since I spoke here last week. When I was in this House last Thursday, I outlined the following points, which I do believe are worth repeating once again. School and education more broadly is a hugely powerful and positive force in young people's lives, and it is vital that this is preserved for our students in these most challenging times and circumstances. International organisations, including the World Health Organization and the United Nations Children's Fund, have outlined the negative impact of school closure on children's health and well-being, as has the Economic and Social Research Institute. For many children, school is not only a place of learning, but it also provides opportunities for social and personal development, healthy eating and physical activity. As the research of a New Zealand education expert, Mr. John Hattie, has shown, school can be a hub of response and recovery, a place to support emotional recovery and promote social togetherness. And this is as important as any academic gains. It is for all of these reasons that Government and the Department of Education has invested heavily in schools to support them throughout this pandemic. In particular, I and the rest of Government are conscious of the particular strain that school closures place on children with special educational needs and indeed their families. Research led by Dr. Carol Barron from DCU School of Nursing, Psychotherapy and Community Health found that during the last period of school closures, children with special needs were suffering from a lack of routine, with the disruptions to their daily routines having a significant negative impact upon them. Many children experienced regression during this period of social isolation, and it negatively impacted on their mental health. In many families, this earlier period of closure was a traumatic and deeply stressful time both for children and for their parents and siblings. A survey by Inclusion Ireland in May 2020 found that, and I quote, "Educating at home is not working well for most respondents to Inclusion Ireland's survey. There are huge barriers to educating at home for parents who are not teachers in most cases," unquote. Parents specifically found it challenging to provide education to children with special educational needs, whilst also trying to work from home, work on the front line and isolate at home, or care for other children or elderly adults. It was for all of these reasons and more that the Department has prioritised the reopening of schools and classes for children with special educational needs. As you will all be aware, the Department and I have engaged intensively with all stakeholders to realise this shared ambition. As I have stated many times before in this House, and indeed in other fora, collaboration is at the heart of all that we do in the education system. And this has never been more evident than at this present moment. Over the past year, since the beginning of the COVID-19 pandemic, there has been unprecedented levels of engagement between the Department of Education and stakeholders. It was in this spirit of cooperation and engagement that the Department approached this vital goal of reopening schools for children with special educational needs. It is worth noting that since the 4th of January and this Tuesday, there have been considerable engagements between unions and myself as Minister or senior officials on a near daily basis. All of these meetings were focused on the safe reopening of our schools, and in more recent days they had been particularly focused on the more specific question of reopening special schools on a phased basis. There has been near daily contact with stakeholders, as I've said, in this time period. Before I spoke before this House last Thursday afternoon, I had attended a meeting with primary education stakeholders, and that would include representatives of parents, teachers, SNAs, school management bodies and principals. Following on from this meeting, and the many engagements which had preceded it, all stakeholders agreed that we would work together towards the shared objective of a staged reopening of special and primary schools for children with special educational needs. Following on from this, the Department wrote to special schools and primary schools on the 14th of January, addressing concerns in relation to a phased reopening of primary and special schools for children with significant additional needs being planned for this week. The issues addressed included advice on school safety measures, risk management, school transport and childcare. On the 15th of January, the Department wrote to special schools and primary schools setting out details of the framework under which it is intended that in-school teaching and learning would take place in special schools, special classes in mainstream primary schools, and for pupils with special educational needs who attend mainstream classes in primary schools. This guidance was agreed with the INTO and FORSA. The measures set out to provide for pupils in special schools to return to school and attend on alternate days, pupils in special classes in mainstream primary schools to attend every day, pupils with significant additional needs in mainstream classes in primary schools to have access to in-school teaching and learning in special education teaching groups. As we are all regrettably aware, it has not been possible so far to secure agreement for a partial reopening of schools for children with special needs. Both Minister of State Madigan and I will continue to engage with stakeholders to achieve an early return to in-school teaching and learning for this priority group of children. At a webinar for school stakeholders attended by over 16,000 teachers, SNAs and school staff, public health doctors, while acknowledging that at present the mobility of 1.1 million people in the education sector would not be advisable, reiterated that schools are safe places for both students and adults because of the mitigation measures now in place in our schools, which include guidance in relation to social distancing, mask wearing, hand hygiene, cleaning and school transport. This event provided an opportunity for teachers and special needs assistants to ask questions on the return to in-person learning for children with special educational needs and the public health considerations on this. This webinar related the messages from our public health experts that schools are safe for staff and pupils and builds on the confidence in our schools concerning the virus and the management of the risks associated with it. Among the topics covered were safety of return to school at present, taking into account the latest information regarding the new variant and the present rate of community infection. In this context, specific reference was made to the experience of childcare facilities to date in 2021. The available data from January 2021 tells us that childcare facilities had a close contact positivity rate of 3.2%, in comparison to a comparable rate in the community in the high teens. In the year to date, the close contact positivity rate for all schools has been below that of childcare facilities. Also covered was the enhanced public school teams, which are being further enhanced by the Department of Education. Close contacts, testing and tracing was also an issue, all of which will continue for schools. I do wish at this point to express my appreciation to our public health experts who have given so freely of their time and expertise. I must say that I was somewhat taken aback by some commentary around their role in recent days, which sought to cast aspersions on their advice. I wish to acknowledge their immense professionalism, integrity and sense of public service, which has been of huge value in the education sector and indeed to society and to our country as a whole. Unions had raised further concerns regarding high-risk staff and childcare arrangements. In response, the Department set out to the unions how it would address these concerns. Proposed measures included putting in place temporary, flexible accommodations for high-risk staff to work remotely or carry out duties where they are not in close contact or providing personal care. These temporary arrangements were only possible due to the very significant reduction of children on site under the proposed phased reopening. Pregnant teachers and SNAs were also given the concession to work from home as part of these temporary arrangements, whilst advice for pregnant education sector staff was developed by occupational and public health doctors. Furthermore, education staff would be eligible for childcare subsidies from the National Childcare Scheme, particularly those on lower incomes. I do want to assure the House that every effort is being made to work with school management and unions in a collaborative way so that children can return to school safely as soon as possible. As I have said, intensive engagement has taken place with all stakeholders, including unions representing teachers and SNAs, INTO and Forsa. This included intensive engagement with public health also. It should be noted that the plan to accommodate for children with additional needs had considerable support among opposition members and indeed was called for both within and outside this House. The Government had paused plans for reopening on January 6th, as the education partners were expressing concerns in relation to proposed reopening on that date. Minister of State for Special Education and Inclusion and myself have listened and are listening to those concerns, and we engage intensively with stakeholders and public health and with disability advocacy groups in order to address these concerns. The recent intensive engagement has not just been between the Department of Education and union representatives, as I have said, but the Department and I and Minister Madigan have been engaging with disability representative bodies and parental representative bodies in relation to how children with special educational needs can best be supported during the current school closure period. It is hugely important to provide in-person learning to this vulnerable cohort of children, and I regret that to this point it has not proved possible. The needs of this group of students are such that no one should be in any doubt of the importance of this goal and its urgency. We all understand how vulnerable these children are and indeed how much they need to be in school. The concerns and fears of teachers and SNAs have been well articulated. I understand and appreciate that this is a time of heightened anxiety for all of society, including those in the education sector, and I say that sincerely. This is a challenging and difficult time, and I do wish to say that we are listening carefully. Public health advice for the education sector has, at all times, underpinned our approach to keeping schools safe and operational. Public health continues to advise that with the appropriate measures in place, we can support the reopening of special schools, special classes and in-person learning for certain children with special educational needs in mainstream schools. Ireland is now an outlier in the European Union in not having in-person provision available for students with special educational needs at this time. We have addressed the concerns raised in relation to safety, including making public health officials available to education partner representatives and subsequently facilitating 3 of the most senior public health officials in the country to communicate directly with teachers and SNAs. The Department has consistently accepted and implemented the knowledge and advice and expertise of public health. This is the first time that unions have refused to accept that public health advice. We have provided guidance on how special schools can operate at 50% capacity to offer these students a return to learning. We have provided guidance and flexibility in relation to staff members who are at high risk of COVID-19 to ensure their safety. We have put in place flexibility for schools to manage this situation and return to in-person learning and to organise and manage their staffing in this context. Our clear focus today, tomorrow and always is on getting children and young people with special educational needs back into their classrooms, and work to achieve that is continuing assiduously. I know the deputies across this House share this objective, and I welcome their positive cooperation and contributions in this House today.